I'm pleased to introduce Dr. Jeanette Chong. She is a pain psychology fellow at Stanford Medicine, and she'll be giving us a presentation on traditional Chinese medicine approaches.
All right, hello everyone, and thank you, Anita, for the introduction. Before I get into the topic of traditional Chinese medicine, I just wanted to quickly review the definition of pain and the importance of a multidisciplinary approach to managing chronic pain. So what is pain? The International Association for the Study of Pain, also known as the IASP, actually revised the definition of pain for the first time since 1979, a few weeks ago. So pain is defined as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. And so the bolded part was added and the grayed out part that you see was taken out because verbal description is just one of the several behaviors that we can use to express pain, and the inability to communicate doesn't negate the possibility that someone's in pain. And so with the IASP's hope with this revision was to better convey the nuances of the complexity of pain, that pain isn't just a sensation or limited to signals that travel through the nervous system, which is what we call nociception. It is much more complex than that. So this revised definition was also expanded on with 6 keynotes to provide further important context. And so a few of these keynotes state that pain and nociception are different phenomena. Pain cannot be inferred solely from activity in sensory neurons. Pain is always a personal experience that is influenced to varying degrees by biological, psychological, and social factors. And although pain usually serves an adaptive role, it may have adverse effects on function and social and psychological well-being. So pain is meant to be adaptive. It is a sign that something has occurred somewhere in your body and that your attention is needed so that you can protect yourself. For example, if you burn your hand on a stove, you'll feel pain in your hand and you'll pull it away as fast as you can in order to protect yourself. However, not everyone will respond to burning their hand in the same way. One person may cry out in pain, another person may clench their teeth and say that they're okay, but both of them will pull their hand away to protect themselves. And so this is an example of how response to pain differs from person to person, despite the fact that the cause of pain is the same. And so pain is therefore not just a sign of damage, but your response to pain is also determined by how you're used to dealing with pain, and other factors such as whether you're feeling stressed or anxious can also make your pain feel worse. Another important aspect of pain is the impact it has on your daily life, such as your job, housework, your hobbies, so your quality of life. And the more that you feel limited by your pain, the worse it can feel. And then other physical and psychological factors can also impact this, such as your culture or your family context. And so you can see that pain is determined by a number of different factors, and it's not the same thing, for example, as getting a fever when you get the flu, where the only factor influencing that is infection. Pain can't be measured in the same way. With pain, there are numerous factors that influence the degree of pain felt. And this is also why pain often can't be treated in any simple manner. And this applies to all types of pain. So whether or not there's a known cause for the pain, it can be applied to pain after an injury or operation, pain from arthritis, pain that comes from aging. And so this approach to pain, which takes into account a number of different factors, is known as the Biopsychosocial Model of pain. And so this biopsychosocial approach to understanding and coping with pain takes into account the biological, the psychological, and social factors that impact your pain experience. And this understanding allows for and encompasses a greater variety of treatment options. And so if you've ever been on the American Chronic Pain Association website, you might be familiar with this metaphor. So a person with chronic pain is like a car with 4 flat tires. And oftentimes with chronic pain, patients have the expectation that all they need is one medication or one treatment that will take the pain away. But that is like only putting air in one of the tires, but you still have 3 flat tires and can't move forward. And so maybe medications and treatments provide 25% of relief, but what else do you need to fill in those other 3 tires so that you can start moving forward again? So for each person, that necessary combination of therapies and interventions is going to look different based on the individual. But in addition to medical interventions, maybe it's adding physical therapy, maybe pain psychology, biofeedback, paying attention to nutrition. And so there are many different ways to fill up those different tires. And today I'm going to be discussing one of those ways. And so the treatment approaches I'll be talking about come from traditional Chinese medicine, or TCM. So TCM falls under the umbrella of complementary and integrative medicine, which emphasizes a holistic, patient-focused approach to healthcare and wellness. So they'll include components like mental, emotional, functional, spiritual well-being, and treating the whole person rather than, for example, one organ system in the body. And so the origin of TCM and the modalities of popular approaches like acupuncture and mind-body exercises, these date back to more than 2,000 years. Traditional Chinese medicine incorporates a range of treatment practices like acupuncture, Tai Chi, to treat or prevent health problems. So in TCM's view of health, there is much less emphasis on anatomical structures and more emphasis on like interactions and relationships among the mind, the body, your emotions, the environment, and it takes into account all those things. And so from this perspective, health is when there is a harmonious interaction between all these different components. And so in TCM, every structure in the body is part of a bigger whole. With your mind, your emotions, your spirit, this whole interrelated system is powered by a life energy called Qi. And so there are 2 important ideas behind TCM. So Qi runs throughout your body. It's always on the move and constantly changes. And so treatments focus on ways to promote and maintain this flow of Qi throughout your body. And any imbalance to Qi can cause disease and illness. And so the second belief is that everything in life has its opposites, called yin and yang. And the balance of this yin and yang is key. So yin and yang are opposites that describe the qualities of Qi. Yin is feminine. It represents the moon, the cold, the inner aspects, and a downward motion. Whereas yang is masculine. It represents the sun, the warmth, outer aspects, and an upward motion. And so it's really it's all about balance. And according to TCM, these play out in our bodies. And so biopsychosocial influence, such as stress, being inactive, poor nutrition, those upset that balance between the yin and yang, and consequently that flow of Qi. So when you rebalance the yin and yang of Qi, you feel healthy and well. And so prevention is the best cure. In TCM, there are as many as 2,000 acupuncture points on the human body, and these are connected by 12 main meridians. And it's at these specific acupuncture points where the Qi can be accessed and where you can try to stimulate the flow. And so there's also, yes.
So sorry to interrupt, but it seems that maybe your video is blocking the photo that some people are interested in seeing. If it would be possible
To turn my video off.
Yeah, if you stopped your video, I think maybe people wanted to see.
How's this?
Hopefully that's better. I'll let you know. Thank you.
Okay. And so in TCM, like I said, there are 2,000 acupuncture points. And so it's important to try to access these acupuncture points to access the qi. And then there's also this belief that our bodies contain the same 5 elements found in nature, and therefore they follow the similar laws of nature. These elements, the wood, fire, earth, metal, and earth, represent how the structures and systems in our bodies are connected to each other, and how we are connected to our environment and the natural world. So when one of these elements becomes out of balance, the other systems and elements have to compensate. And eventually, after enough time, physical ailments or emotional difficulties can begin to manifest when this balance is out of whack. So again, the goal is to rebalance all these elements. And in TCM, changes in nature are always reflected in your body. So TCM factors in the particular season we're in, the geographical location, the time of day, in addition to your age, your genetics, and the condition of your body. So it really takes into account many factors. And so in order to diagnose the patient's imbalance of qi for proper treatment, a TCM practitioner may evaluate the condition of your tongue, such as the shape, the color, and the coating. They may also evaluate the strength of your pulse points, and maybe the quality of your breathing. And so practitioners use a variety of modalities for treatments, and these treatments are always catered to the individual. So it's not a one-size-fits-all. It's individualized and not solely to the symptoms. So 2 people with similar symptoms might receive different treatments depending on how their body is made up and what their qi is like. And so in today's presentation, I'm going to focus on evidence-based TCM treatments. So research on TCM and complementary and integrative approaches in general, they're continuing to grow as these treatments become more common, more popular, so that we can identify more safe, effective therapies, and then also be able to identify therapies that really don't offer any benefit and sometimes may even cause harm. So in general, there has been a lack of research because a lot of these large controlled studies are costly, and trials for conventional treatments like medications or stimulators are often funded by big companies who develop and sell these products. And so there might be fewer resources available to support trials of integrative approaches. But again, that is slowly growing. And so we'll continue to see more and more research. So I'm going to start with acupuncture. So acupuncture is a technique in which a practitioner stimulates acupoints on the body by inserting thin needles through the skin. So in TCM, this is to rebalance the flow of qi. If we look at the biomedical model, acupuncture is thought to relieve pain through the gate control mechanism, or through the release of neurochemicals. So as more research is being conducted, we're seeing more possible mechanisms of action that fit within Western medicine. And so this understanding has helped make acupuncture more acceptable in the United States and other Western countries. And so in clinical trials, researchers usually test a product or a practice against an inactive product, which is called a placebo, to see if the response is due to the actual treatment or to something else. So often in acupuncture trials, they rely on a technique called simulated acupuncture. So they use a blunt, retractable needle that touches the skin, but it doesn't actually penetrate. Whereas in real acupuncture, needles penetrate the skin. And so in some instances, researchers have found that simulated acupuncture, so where the needle doesn't penetrate the skin, resulted in some degree of pain benefit. So the current science suggests that many factors, including a patient's beliefs, a patient's expectations about acupuncture that are actually unrelated to like the acupuncture needling, those actually play an important role in the beneficial effects. And so that's an interesting finding. Acupuncture is generally considered safe when it's done by an experienced practitioner and when you use sterile needles. It's important to tell all your healthcare providers about any integrative approaches you're using so that it gives them a full picture of what you do to, manage your health and ensure that your care is coordinated and you're receiving safe care. So acupuncture, for acupuncture, there's evidence suggesting that it helps with low back pain, neck pain, osteoarthritis, headaches, and fibromyalgia. And so I have a demonstration here. So this is a demonstration for a patient with knee arthritis using acupuncture. An acupuncture session usually lasts about 30 minutes. The patient lies down on a cushioned table, face down, face up, or on their side. And then before inserting the needle, the acupuncturist will swab the skin with alcohol or another disinfectant. When the acupuncturist inserts the needles, there might be a slight sharp sensation, but usually the procedure is painless. After all the needles are placed, they are sometimes gently stimulated by hand or with electricity, which you'll see in a second. So in this demonstration, the practitioner is attaching electrodes to the needles in the chi endpoints. So with FDA regulations, practitioners must use new sets of disposable needles taken from a sealed package for each treatment, just to make sure everyone is, safe and hygienic. So some people might feel energized by treatment while others feel relaxed. Treatment might take place over several weeks or more, but it really depends on that individual. You're not just looking at the condition or symptoms. Who the person is plays a big role in their treatment plan as well. So next, we are going to talk about Tai Chi and Qigong. So these are mind-body practices that involve certain postures and gentle movements with mental focus and breathing and relaxation. So the benefits of Tai Chi and Qigong are likely associated with their effects on the autonomic nervous system. So our autonomic nervous system regulates many of our body functions, and there are two branches. Our sympathetic nervous system, which is our stress or our fight or flight response, and then the second one is the parasympathetic nervous system, our relaxation or our rest and digest response. And so the stress response gets activated anytime we perceive threat or stress in our environment. It causes our breathing to increase, our heart to beat faster, our muscles to tense up, our pupils to dilate. And all this is a way for you to be ready to run from or to face immediate danger. At the same time, our sympathetic nervous system slows down the body functions that aren't needed in the moment, such as your digestion, your immune system, your peripheral vision, and certain brain functions. So our body's fight or flight system response is pretty helpful if the danger that we are faced with is short. When the perceived threat has passed, then your parasympathetic nervous system kicks in to calm things down again. And so your parasympathetic nervous system lowers your blood pressure, your heart rate, and respiration. In addition, your immune system comes back, your digestion ramps up again, and your whole brain is accessible again. It's a relaxation response and it feels good. A big problem is that many people today face situations or perceived threats that just don't go away. It might be difficulty at work, an unreasonable boss, maybe a family member's illness or financial problems. These are all different examples of things that can stress you out on a daily basis. And the reality is that pain itself is a chronic stressor, and it cues up many of these responses. So since your pain is persistent, your body doesn't really get much time to recuperate. So it leaves you in this chronic state of fight or flight. And so with your immunity constantly turned down, your digestion not working well, and your heart racing, your overall health takes a hit over time. But the good news is that we can actually retrain our bodies to respond to pain differently by incorporating different techniques for that relaxation response. And so one of these ways is through Tai Chi and Qigong. So Tai Chi and Qigong are generally safe, but again, talk with your health provider before starting and make sure that your instructor is familiar with your health situation. Ask a trusted source, such as your physical therapist or your doctor, your pain physician, to recommend a Tai Chi or Qigong instructor. Make sure to find out the training and experience of any instructor that you're considering. So there is evidence suggesting that Tai Chi may help with improving balance and stability, knee osteoarthritis, and fibromyalgia. Evidence suggests that Qigong may help with chronic neck pain and fibromyalgia. So this is a Tai Chi demonstration with some Qigong components. The goal is to cultivate Qi with movement, breath, and meditation. So with Tai Chi, it's generally more complex. It involves a series of movements that work on the entire body in a flowing sequence, and there's a lot of focus on form. Qigong is often just one single movement repeated over and over, and sometimes does not involve movement at all and might even just focus on breathing. Okay, so next we have Tui Na, or acupuncture. And this is similar, sorry, not acupuncture, acupressure. And so this is similar to acupuncture in the way it targets specific acupressure points. But practitioners use their hands and fingers to apply that pressure to stimulate these points. And so again, the goal is to rebalance the flow of qi. In the biomedical model, Tui Na is thought to relieve pain through increased blood flow, relieving muscular spasm, and releasing beta endorphins, which are produced in the brain, especially in the pituitary gland, that blocks the sensation of pain. And so Tui Na can be done as a stronger deep tissue massage or a more gentle energetic treatment. Some techniques are more yin, so more gentle, passive, and meditative. And then the yang approach is more active, more physical, and it creates more intense sensations by stimulating those deep blockages and knots. And Tui Na massage uses techniques such as acupressure, myofascial release, and reflexology. And sometimes techniques that are common to osteopathy and chiropractic techniques like stretching and joint mobilizations are also used. And so Tui Na is generally safe, but again, talk to your healthcare provider to find out if any special precautions are needed, and choose a qualified therapist and explain your medical conditions to the therapist. So there is evidence that suggests that Tui Na is helpful with low back pain, with chronic neck pain, and fibromyalgia. And so this is a video demonstrating some of the techniques that might be used. This sweeping motion with slight to moderate pressure is meant to increase circulation. Another technique is using the thumbs to press and stimulate acupressure points. And so this might be effective on areas of the face where you don't really want a lot of pressure, but just want to increase stimulation. And then another is a rolling motion with the back of the hands and a loose arm to alleviate tension. So this might be done on large muscles or large muscle areas such as your back, your buttocks, and the legs. And so this presentation is meant to kind of just give a bird's eye view of a few evidence-based TCM treatments. If you're interested in knowing more about acupuncture, Tai Chi, or other TCM approaches, I want to provide you resources that you can explore on your own. And so this first one is a lecture. This is kind of a deep dive into acupuncture by Dr. Kong, who is a pain physician at the Stanford Pain Management Center, and she leads the acupuncture service in the pain clinic. And so Dr. Kong has a strong interest in the interdisciplinary study of chronic pain mechanisms and alternative treatment modalities such as acupuncture. So she currently leads 2 NIH-funded projects investigating the mechanisms of electroacupuncture for chronic low back pain. And so this is a great lecture to watch if you're interested in learning more about acupuncture. And then on the right side, the American College of Traditional Chinese Medicine and Five Branches University are kind of considered the top tier TCM schools in the Bay Area. And they both have teaching clinics. So they offer acupuncture, Tai Chi, Qigong, and Tui Na in their clinics. And their clinics are led by clinical interns who are in their kind of final phase of a 4-year program, and they're under the direct supervision of clinical faculty who are licensed practitioners in California. And so these are 2 really good resources for people living in the Bay Area. If you don't live in the Bay Area and are interested in schools and teaching clinics in your area, you want to make sure that they're accredited by the Accreditation Commission for Acupuncture and Oriental Medicine. And then for practitioners who are not associated with any programs, you want to make sure that they're licensed by the State of California Acupuncture Board. And so these are the links to those resources, and I'll also have them available again at the end of this slide so you can screenshot it or copy it. And then, so these are resources for Tai Chi and Qigong done by Dr. Karianis, who is a physical therapist in the pain clinic at the Stanford Pain Clinic. And he's also a certified Tai Chi teacher. So he is involved in research that looks at sensory, motor, and psychological mechanisms of mind-body interventions, such as mindfulness-based stress reduction and Tai Chi for people with chronic low back pain. So there are a series of videos on the Stanford Pain Medicine YouTube channel that demonstrates Tai Chi and Qigong in standing and sitting positions, which are useful for patients that might be just kind of getting back and re-engaging into movement again. So this is a great resource. But although these videos are helpful and kind of give you an idea of what Qigong and Tai Chi look like, learning it from a video or a book doesn't necessarily ensure that you're doing the movements correctly or safely. So again, if you're interested, go on, get an idea of what that looks like, and then ask a trusted source, such as your healthcare provider or your PT, to recommend a Tai Chi or a Qigong instructor. And if you're considering traditional Chinese medicine or just complementary integrative approaches in general, this ebook is a good resource. The National Center for Complementary and Integrative Health published a 47-page ebook last year that provides an overview of complementary health approaches for pain. And so this ebook has basic facts about pain and about complementary health approaches. It explains issues patients should consider to make sure that they're safe when they're using complementary approaches. There's research. It discusses how to be an informed consumer and frequently asks questions for patients looking to try complementary approaches. And so I think in particular, the section on being an informed consumer is particularly helpful. There's a section on complementary health information on the internet. So that's important because the easiest way to look for health information is through the internet. There are a number of websites and social media sites and mobile apps that have information on complementary and integrative health. And some sources are useful, but others might be inaccurate or misleading. And so this ebook suggests, 5 questions you should ask yourself when you're looking at these resources, such as who runs or who created the site or the application, are they trustworthy sources? What is the site or the app promising or offering? Does it seem too good to be true? And then when was the information written or reviewed? Is it up to date? Where did this information come from? Is it based on scientific research? And then why does the site or app exist? Is it trying to sell something? There's also a section on mobile health apps, keeping in mind that the content on a lot of apps aren't written or reviewed by medical experts. And so, question the accuracy and safety of them. There's a section on where to find reliable information. So healthcare providers and pharmacists are good resources for learning about some of these approaches. You can contact the NCCIH clearinghouse, and they have resources in English and Spanish if you're interested in publications or any scientific databases. There's a section on selecting a complementary health practitioner. So the main suggestions are, if you need names or names of practitioners in your areas, first check with your doctor or other healthcare providers, usually nearby hospitals or professional organizations, or even your health insurance provider may be helpful. Making sure to find out as much as you can about any potential practitioner, including their education, where they did their training, where they're licensed, any kind of certifications that they have. It's important to find out whether the practitioner is willing to work with your conventional healthcare providers so that you can have safe, coordinated care. And then really important, explain all of your health conditions to the practitioner. Find out, the practitioner's training and experience in working with people who have your specific condition. And then, don't assume that your health insurance will cover the practitioner's services. So that might vary from insurance to insurance. So making sure to find out more. But this ebook is just a really useful resource to look through. It's free and it's on the NCCIH website for you to download. And so some take-home messages, again, multidisciplinary pain management is the most effective approach in treating chronic pain. When relying on medications or just one treatment to take away the pain, again, that's like putting air only in one of the tires. So what are some other ways to fill up those 3 tires? And so integrating traditional Chinese medicine techniques into your treatment plan can help optimize that biopsychosocial approach. Specifically, acupuncture, Tai Chi, Qigong, and Tui Na are some evidence-based approaches that have been shown to help with a variety of chronic pain conditions. Although, what I discussed today was evidence-based, it doesn't necessarily mean that it is safe for you. So using it inappropriately could also be harmful. And so always tell all of your doctors and other healthcare providers about any complementary approaches that you're using. Don't use a complementary approach as a reason to delay seeing your doctor or other healthcare providers about pain or any health problem. You might have a medical condition like an infection that needs to be treated promptly. So if you're waiting while you're trying other approaches, your condition could get worse. And if you're thinking about stopping or not starting conventional treatment, discuss it with your healthcare provider. Sometimes going without conventional care can lead to serious problems. So again, this next slide is just a summary of the TCM resources that I previously mentioned on one slide in case you just want to screenshot it or copy them.
Thank you, Jeanette, for that wonderful and informative presentation.